Ever started a solids journey and suddenly wondered, wait, is that gagging or choking? Or maybe you're asking, why won't my baby eat the food they loved yesterday, or just staring at that mango? If you've ever felt that mix of confusion, panic, or straight up frustration during mealtimes, you're not alone. I'm Dr. Mona Amin, a board-certified pediatrician and mom, and in today's video, we're diving into some of the most common feeding concerns I hear for babies under 1, gagging, food refusal, and how to know when something more might be going on. And hey, if you missed part 1 and 2 of this series, be sure to check those out after this video, or pause this one and go check those out. We covered when and how to start solids, what first foods to offer, and how to prep them safely. And if you've been enjoying this feeding series, make sure to subscribe so you do not miss any of the other videos I have coming your way. Let's get into it. First things first, let's talk about something that really freaks parents out: gagging versus choking. Here's the difference. Gagging is louder, it's dramatic, but it's actually protective. You might see coughing, watery eyes, or tongue thrust. And while it's alarming, it's a normal part of learning to eat solids. If you see it, do not startle them. Do not jump up and start slamming on their back, as this can actually make the food go down the airway. Choking, on the other hand, is silent and dangerous. Wide eyes, no sound, no breathing, no crying. That's a medical emergency, almost like a deer in the headlights. If you remember one thing, gagging is noisy and protective, choking is silent and requires immediate action. This is why I always recommend sitting your baby upright for meals. They shouldn't be falling over. They should be having all the signs of readiness that you can get from this handout below. Always supervise your baby while they're eating. Does this mean that you have to stare at them like a hawk? No. Be relaxed. You can be in the same room. You can be doing dishes as long as you can visualize your child, hear noises, or hear if they're not making noises. That is very important. Know infant CPR and share that knowledge with anyone who feeds your baby. And also prepare your food safely for their age. See my last video for more on how to do that. Here's another pro tip on gagging. As they work up the food by gagging, positively reinforce. Yes, great job working that up. You did it. Encouraging them to trust their body's protective instinct. And another pro tip, which is what we did with our daughter: if gagging is common, consider using safe oral mapping tools like a teething tube to help your baby learn how to move food and objects around in their mouth. It helps desensitize and strengthen oral coordination. My daughter had a very sensitive gag reflex, and gnawing on a mango pit and using these teething tubes really helped. Another pro tip: some babies gag more with spoon feeding because they're not in control. You would do the same if something was forced down your throat. Try preloading the spoon and handing it to them. It builds skills and confidence and can actually also help with that oral exploration when they put that spoon in their mouth. We talk a lot more about this inside my Introduction to Solids workshop, which is linked in the caption below. Let's normalize something. Food refusal is common, and it doesn't always mean something is wrong. But here are a few things to check first. 1, is your baby developmentally ready for solids? Can they sit upright with support, show interest in food, and open their mouth when offered a spoon, or be able to grab if they're self-feeding? Readiness matters. 2, would you eat the food you're offering? Like, really? Pureed peas that taste like bland mush? Probably not. If it wouldn't pass your own taste test, don't expect your baby to be too thrilled. Remember, babies deserve flavor too, and foods in safe consistency that taste better, like steamed carrots is much better than pureed carrots, or peas that are cooked and steamed are much better than pureed peas. Seasonings like garlic, cinnamon, turmeric, they're all safe and can make food way more enjoyable. A lot of that refusal could be that they just don't like the taste because it just tastes like bland mush. Next, timing matters. Try not to offer solids too close to a milk feed. If your baby is older than 6 months, you can even offer food before milk, once a day, to help build appetite and interest. Your baby might push the spoon away, turn their head, close their mouth, or get distracted easily, or throw the food on the floor. Basically, 1 minute they're begging for a banana, the next they're acting like you just tried to feed them a shoe. It's not personal, it's them learning. Some days they're ravenous and other days they're not interested. This is totally normal. If you want to mix it up, you can. Try a different time of day. Sit and eat with them. Babies are great imitators. Offer foods in different textures or shapes. Break up a plate into smaller bites and hand them one at a time. A full plate can be very overwhelming for a baby, which can cause them to start throwing or get very disinterested. And a pro tip, if your baby refuses a food today, try it in a new form tomorrow. roasted, mashed, steamed, or mixed with a favorite texture makes a big difference. And quick note, try to limit distractions. No screens, no toys at the table. It might feel like it helps in the moment, but it teaches babies to tune out to their hunger cues, and meals are for connection and not cartoons. One thing to check in with yourself about: are you holding back on advancing food because you have a fear of allergies or have a fear of choking? If your baby doesn't have a known allergy or is high risk, it's okay to keep introducing new foods regularly. Variety early on is protective and not harmful. We already spoke about gagging. It's important to know what the difference is between gagging and choking and how to intervene if your child is choking and how to minimize that risk. When it comes to allergies, if your baby doesn't have a known allergy or is high risk, it's okay to keep introducing new foods and allergenic foods regularly. Variety early on is protective and not harmful, and make sure to watch my food allergy series here for more. And if you're loving these tips so far, don't forget to hit that like button and subscribe, because parenting is full of curveballs, and whether it's sleep, feeding, or tantrums, I've got more videos to help you feel confident every step of the way. Let's talk about one of the most frustrating but totally normal parts of feeding: when babies throw food or swipe everything off their tray like they're on a mission to feed the floor. Here's the thing, this isn't bad behavior, it's communication. Babies throw or swipe food for a few reasons. They're overwhelmed by how much is on their tray. They're signaling that they're done or bored. They're testing cause and effect. What happens if I do this? They don't know what else to do with the food. Here are some tips. Keep portions small. Too much food can feel like a sensory overload. Start with just a few items on the tray and then add more as they eat. Or you can hand them the food, just say you're doing baby-led weaning, and allow them to take it from your finger so that they can slow down, eat that, and then you can hand them the next item. Another pro tip: narrate and model and show them what to do. If your baby is swiping food, calmly say, "Food stays on the tray." Then demonstrate by picking up a piece and showing them where it goes. We eat food. Exaggerate that biting motions. We eat food. I put it here when I'm all done, showing them where it goes, that it doesn't go on the floor. Babies and kids learn way more from what they should do than what they should not be doing. So tell them what to do. Paint that picture of what you want so that we can minimize the throwing and the mess. Next tip: if your baby is consistently throwing food toward the end of the meal, they may be telling you that they're done. You can ask, "All done," and use a hand gesture like baby sign language to reinforce it. Then end the meal with calm, clear boundaries. The next tip: use a silicone suction plate or serve food directly on the tray to reduce temptation and mess. And remember, repetition is key. It may take a while, but with consistency and modeling, your baby will start to understand what mealtime is all about. Another question I get a lot is, are they eating enough? For babies under 1, remember that breast milk or formula is still their primary source of nutrition. Solids are about practice, exposure, and building skills, not filling up their belly. That means some days they're going to take a few bites, and other days they might surprise you with how much they eat. Totally normal. Instead of focusing on ounces or spoonfuls, focus on the experience. Are they showing interest in food, trying new textures, trying new foods, gaining weight along their curve at doctor's visits, having plenty of wet diapers, and regular stooling? If yes, they're likely getting what they need. Another tip: babies' appetites can dip during teething, illness, or developmental leaps. Trust the long game. Offer a variety of foods, keep the pressure low, and let them lead. By around 9 to 10 months, many babies are doing 2, maybe 3 meals a day, but breast milk or formula still plays a big role, but it can decrease in volume due to food exploration. This is normal and the goal of infant nutrition, where as they approach 1, most nutrition is through food. Let's talk about when it's time to bring in support, especially during that first year of feeding. Some food refusal and gagging is normal, especially as babies grow into toddlerhood, but here's what to watch for in babies under 1. They are not eating any purees by 7 months. They're not progressing beyond purees or tolerating textured foods by 10 months. Gagging, choking, or vomiting during most meals. Gagging that leads to refusal, crying, or little to no intake. Swallowing difficulties during meals, like frequent coughing or food pooling in the mouth. Mealtime distress for you or the baby, where it's just not enjoyable anymore, even with all these tips in all 3 of these videos. They're not gaining weight or following their own growth curve. Also keep an eye out if your baby is refusing food consistently alongside a history of reflux or feeding trauma. They have meltdowns, panic, or extreme aversion when offered new foods or placed in that high chair. If any of these red flags sound familiar, talk to your clinician. An early referral to a feeding therapist or specialist can make a world of difference and bring a lot of peace of mind because the feeding journey should be enjoyable and not stressful. You are not failing. You are paying attention if you bring this to our attention. And here are some of my pediatrician-mom approved tested strategies that actually make feeding easier and more enjoyable. Start small. When you're starting solids, you're going to start with single ingredients, so of course you're not going to be overwhelming them. But as you start to advance and introduce multiple items at one meal, it's important to keep the portion sizes small. You can always add things later. The reason is that a lot of food on their plate can be very overwhelming, and that's when we can see more of that swiping or throwing or disinterest because of just how much food is on their plate that they don't even know where to begin. Stay grounded. Your baby takes cues from your body language and facial expressions. If they gag or hesitate, breathe. Smile, channel your inner, it's no big deal. Let them play first. When you're starting solids, especially in that first year, exploration comes before expectation. Touching, squishing, smearing, that's sensory learning, not a mess to clean. Feeding can take sometimes 45 minutes when starting out. This is why I want to be very clear that sometimes when we do parent-led feeding, like spoon feeding, we want to get through the meal fast, so we rush them. We force the spoon in their mouth. This is not listening to your baby's cues. It's so important whether you're doing puree or baby-led weaning that you're allowing them to eat slower. This is actually very healthy for adults too. If we're scarfing down our food, that is not healthy for our digestive system. Slowing down our meals is something that we can teach our kids from a young age so that they are more mindful with their feeding journey. Encourage mixing. Divided plates are fine, but real meals don't come in compartments. Let the food touch, let flavors mingle. If you're using divided plates, go rogue, let food cross the lines. Pair new foods with safe favorites. A familiar taste can ease nerves and increase the chance they'll try something new. Show them what to do. This is when you need to become your inner actress or actor. Bite with exaggeration in front of them. Say, and have fun. Babies are watching and learning. Even if your baby isn't hungry, let them sit at the table with you during meals so they can watch what you're doing, how you pick up the food, how you use your teeth and your jaws to move the food around and eventually swallow. Kids need to learn by being shown what to do. Exposure matters. Just being around food and watching others eat builds familiarity and reduces fear. And above all, no pressure. Your calm confidence is more powerful than any puree recipe. Let feeding be a practice and not a performance. Bottom line, feeding concerns can happen, but you don't have to figure this out alone. Your baby isn't broken, they're learning. And the more calm, supportive, and consistent you can be, the more confident they'll become. If this video helped ease your mind, give it a thumbs up sign and share it with another parent who might need this. Don't forget to download my free solid resources in the caption and check out my full Intro to Solids workshop for support with texture progression, reducing gagging, and knowing when to ask for help. And subscribe so you don't miss what's next here on PedsDocTalk. We'll keep walking this journey together one bite at a time. And I want to know what you want. Don't forget to comment below on future video ideas or comment in the community section so I can build videos that you actually want for your families. This is how we can continue to grow together in this parenting journey. I'm Dr. Mona, and I'll see you all next time.